So we spend a lot of time talking about the protection of our staff here at the downtown campus. But a question that came in was, is there adequate protection for staff that are not located at the main hospital? For example, SRCC or the medical clinic, our South Campus? And is there consistency in the training at the off-campus locations for evaluating patients who present at the door who might have fevers and coughs to protect those employees?
Yeah, so the protocols I just described apply across the entire organization. So whether you're in the skilled nursing or subacute unit on Court Street, or you're in the acute rehab or skilled nursing facility on West Street, or you're right, our cancer patients that are in SRCC, all of the leaders in those areas, they're all actively involved in this whole incident command system. And so they're participating. Yesterday on the phone, we've got Jamie, who's our director over mental health. We've got Lisa Harold, who's our director over skilled nursing and rehab. They're all in on these calls. They're all going through the same, protocols and training. Each area might have different unique aspects that apply to them because of maybe higher risk or lower risk. So, skilled nursing was one of the first areas we locked down to visitors because that was a very vulnerable population. You saw what happened in Washington State in a skilled nursing home. So they probably instituted more restrictive, not just visitor, but how they use PPE, both on the patient and the staff. So the short answer would be yes, uniform training and use of the protocol across the whole organization. But again, kind of customized too. So if you're working in patient accounting or finance, you're still part of the hospital, you're still part of the health system, but you don't have really contacts with patients. So we're not going to be issuing them personal protective equipment. And where they might have routinely come into the hospital for meetings or things, we're keeping them out now to minimize their exposure and exposure to the people in the medical center.
Right,
So,
and you've sent several employees to work from home. Do we know how many employees
yeah.
are working at home?
Yeah, we probably have now deployed about 200 of our staff that were in areas that can still effectively do their job from home on their computers, on their phones, on iPads, things of that nature. So yeah, again, just out of wanting to protect them and minimize exposures, they've been working at home for probably about 2.5 weeks now.
Okay.
And we're always looking for opportunities. If there's more, then we'll exercise that as well.
Yeah. It's very difficult to communicate with 5,000 employees. So how do we do that?
Well, I've become a big fan of Zoom, and we actually, earlier this morning, usually once a month, our entire leadership team, almost 200 of all our vice presidents, our directors, our managers, our supervisors, we all gather together in what we call the Blue Room, which is in the basement of the Acute Medical Center, kind of our large conference room. And we'd all physically be there, holding our monthly meeting, sharing information, and so forth. So for the first time in our 60-year history, we did a virtual meeting. There were only 8 of us in the room, all carefully spread out. And our ISS department, who are just wizards in this technology, had it all set up where we did a go-to meeting. And I think they said we had about 150 people that were in their offices, listening in on this leadership team meeting. So we're doing a lot of that to still keep employees connected. So a lot of using Zoom, using GoToMeeting, teleconferences. So that's one way to keep people engaged and informed. But we also have launched a very robust internal and external communication network. So every day we publish a newsletter, the COVID-19 news you can use. And that's a document that we actually send out to the public too. So we post it on our website, on social media, and it's a real-time update of things that are going on. new things that we've implemented, again, to keep people safe. And so we use that mechanism, definitely our website, social media. We have an email system that has a distribution list called District Urgent, and it literally goes out to every single employee, all 5,000 of them. And so we send out communications on that to keep people informed. And then we have a text subscription that if there's something that is breaking, that is really urgent, that we need our employees to know right away, then we send these urgent text messages that hit every employee's phone. And I believe we just signed up about 2,000 additional employees that now are receiving this text subscription.